Okay, this is case management of AC. This is for Nursing 442, Nursing Case Management of Vulnerable Populations, and my name is Christine Velasquez. So AC and diabetes, this is his background information. AC is a 46-year-old African-American male. He was sent to the hospital from his boarding care facility after routine lab work indicated he was retaining too much potassium, and he was refusing to have his blood sugar checked by nursing staff. Upon arrival, AC was placed on psychiatric hold, in which he is not allowed to leave the facility for 3 days. However, he was placed on medical surgical floor to be medically stabilized, even though he was on a psychiatric hold. And he was very upset about being held against his will and was verbally abusive to nursing staff. AC comes from lower middle class socioeconomic background. He is unemployed and receives disability benefits due to his previous diagnosis of end-stage renal disease and various psychiatric disorders, including schizophrenia and bipolar disorder. He's single, he's been divorced, he has 2 daughters who live out of state and do not regularly keep in touch with him. AC's main support comes from his mother, who calls about once a week to check up on him. However, she's unable to get to the hospital to visit him. And he also has Medi-Cal and Medicare benefits. He has been diagnosed with end-stage renal disease, diabetes out of control, and hyperkalemia. His diagnoses are interrelated and were probably exacerbated from noncompliance of the patient to his medical regimen, probably because of his mental health issues. Um, End-stage renal disease is the last stage of chronic kidney disease, and it leads to poor filtration and removal of excess waste and fluids. So in end-stage renal disease, the kidneys function so poorly that dialysis or kidney transplant is needed in order to survive. End-stage renal disease also causes severe electrolyte imbalance, such as the hyperkalemia that AC is experiencing, because it's not able to filter the potassium out of his blood. AC self-care capacity. Failure to control blood sugar levels when diabetic can result in chronic kidney disease. Sugar molecules in the blood can damage blood vessels of the kidneys, which lead to retention of fluids, causing hypertension and further damaging the kidneys. So AC requires certain skills for maintaining and managing his self-care. In order to manage his diabetes, he has to know how to use a glucometer or know where to have it performed. If he performs the checks himself, he must understand the data rendered and how it applies to his insulin use. So whether he's on a sliding scale or not. The use of insulin requires knowledge of how much to give, when to give it, how to inject the insulin, what location of the body to inject it in, and how to store the medication. For dialysis purposes, he must understand how to effectively care for his permacath access, or he has an AV fistula, his AV fistula access. It's important to keep the area surrounding the permacath or the AV fistula clean in order to prevent any infection of that area, because it is a direct line to his bloodstream. Obtaining regular dressing changes or performing the dressing changes himself is a self-management skill that AC needs. He also must understand that once an AV fistula is created in his arm, he must notify all healthcare staff in all settings that a blood pressure, blood draw, or IV cannot be placed or taken from that arm or that extremity. In addition to maintaining the access, AC must know how to schedule and keep his dialysis appointments and lab follow-ups. So he has to um, be able to figure out transportation and get there to those appointments. Priority patient issues for discharge planning. So AC's chronic illnesses include diabetes, kidney disease, and hypertension, and they are most likely caused by noncompliance with the diet and exercise program and poor management of blood sugar and insulin use. So this is our main issue when thinking about discharge, is that we really want AC to know how to properly manage his diet and exercise and how to properly perform insulin injections, and also how to check his blood sugar correctly. Where to discharge AC? So using clinical judgment, we must look at how well AC performs his ADLs and IADLs in order to assess the best place for his discharge. So this is basically going to figure out how independent he is. AC has demonstrated the ability to perform his ADLs independently. However, he often goes days without bathing or performing personal care due to his desire to be left alone in his room. So again, because of psychiatric issues. So this indicates that, again, his psychological disorders interfere with his optimal functioning. AC is able to transfer from his bed to his wheelchair, and he enjoys wheeling himself around the hospital unit. He is able to bathe himself in the wheelchair accessible shower. He changes himself and he performs oral hygiene. AC's IADLs, or instrumental ADLs, require more assistance. He has explained that he lived in various boarding cares and skilled nursing facilities, and for this reason, AC says he does not have to cook or clean very much. He does not go grocery shopping, but frequently goes to a liquor store to purchase snacks, candy, and soda, which again, we would educate not to eat snacks like candy and soda. He independently uses public transportation. He can use the telephone and look up numbers, and he can manage his finances, which signifies that he is somewhat able to live independently with some visits to a dialysis center and mental health day program. So for these reasons, AC would fare best at a long-term care facility where he will have access to regular psychiatric treatment and extra help in maintaining his health management plan. His plan should also include encouragement of independence and hopes to transition him from this long-term care facility to complete independent living. That would be the plan. Okay, so priority nursing case management strategy. At the patient level, our strategy would be to utilize the motivation interview to better understand the best approach to the patient and involve his mother for encouragement of his health management plan. This is at the patient level. The system level, we would analyze the shortcomings of the current healthcare system under the chronic care model and use the trans-theoretical model to implement interventions aimed at those shortcomings in care. So intervention for patient level nursing case management strategy. It seems that AC has difficulty in motivating himself to practice healthy self-care behaviors. The motivation interview is a great tool that can be used to help AC set clear, achievable goals in managing his chronic illness. Using this intervention, healthcare professionals can listen to AC and understand what drives him in his actions and empower and encourage him in his health-promoting behaviors. Barrier that exists in utilizing this model is the act of writing the patient's behavior on the assumption that AC is wrong. Physicians and nurses must resist the urge to correct what AC explains as his reasoning for his behavior. I believe this is the best way the healthcare system can make progress in educating AC, because he has often stated that medical staff are always telling him what to do and making him feel wrong. And I think with this, he'll better understand where he's coming from, so he'll feel empowered to make better decisions instead of just being told what to do. Another challenge in using this intervention is, even when knowing AC's rationale for treating his diabetes the way he does, is getting him to change his current behaviors that do not help his chronic illness. For example, a major barrier in AC's health is his socioeconomic status. He lives in a poor area that does not have access to healthy foods and safe, convenient places to exercise. The use of the motivation interview would then attempt to motivate AC to take actions that may seem inconvenient in order to better manage his diabetes and end-stage renal disease. And of course, involving his support system would further encourage AC to maintain healthier habits. AC's mother can play an integral part in his health management. Intervention for the system level nursing case management strategy. So in her research, Larson discussed the implementation of the chronic care model, which analyzes the shortcomings of our current healthcare system in dealing with managing chronic illness. This model highlights three major problems, including primary care offices are set up to respond to acute illnesses rather than anticipate and respond proactively to patients' needs. Patients with chronic illness are not adequately informed about their conditions and are not supported in the self-care of their conditions beyond the physician's office. And physicians are too busy to educate and support patients with chronic illness to the degree needed for them to stay healthy. So AC has fallen victim to all of these problems, and it has become evident in his multiple readmissions to the hospital that our current healthcare system needs to improve in dealing with people with chronic illnesses. AC's diabetes should have been addressed in a manner that would have prevented complications that he now faces, such as his below-the-knee amputation that requires him to use a wheelchair. System-level strategy, then, the healthcare system can help AC manage diabetes, renal failure, and psychiatric disorder if it's better understood. Under the guidance of the trans-theoretical model, healthcare systems can promote consciousness consciousness raising and help AC become more aware of the behaviors that contribute to managing his diabetes and end-stage renal disease. From there, the healthcare system level strategy can include mass media campaigns designed to spread awareness of diabetes and promote healthy eating habits and exercise programs. This was done in New Orleans and it had positive results. Other interventions can also be implemented to better serve AC, such as providing health resources, such as access to a health coach and programs that enhance health literacy. So utilization review. UR is a process in which medical review determinations are made based on clinical guidelines and structured processes. UR modalities use established criteria to evaluate medical services for necessity, level of care for appropriateness, quality, and timeliness of discharge. The goal of UR is to remove the patient from costly treatments as soon as no longer necessary. In the case of AC, UR may find that his constant need of encouragement for health management, compliance, and psychiatric therapy is what makes it impossible for AC to be safely cared for at a lesser level of care or at home. So I listed here basic functions of utilization review and how it's done. So basically, it's a retrospective review of patients' medical records. The use of criteria for the determination of medical necessity. There's no patient or family contact. There's monitoring the allocation of resources, minimal transitional planning function, indirect contact with the interdisciplinary healthcare team, minimal interaction with representatives from health insurance agencies, limited to no appeals of denials, no case conferencing with patients or families. So this is usually done retrospectively and just to see where maybe resources from the healthcare system were not being used adequately or appropriately, or were being wasted. So quality and safety issues. The intent of all improvement processes is to provide excellent care in the first place, evident through patient safety and quality of care, thus lessening chances of adverse events that will need risk management attention. So quality and safety indicators regarding utilization include hospital admission not meeting acute criteria, readmission within 30 days for incomplete management of problems of previous hospitalizations, readmission within 15 days for the same diagnosis, receipt of Medicare denial, and delays in diagnosing increasing lengths of stay. So AC is at risk for meeting these indicators as he has been readmitted for the same diagnosis in the past. So these are things that we would be looking to avoid, make sure that we are doing a good job in teaching him and make sure we're doing a good job in case management so that he has all of the resources that he needs to help him manage his chronic illness once he's discharged and prevent being readmitted to the hospital. So now let's look at outcomes. Nursing case management effectiveness at patient level. So nursing case management effectiveness at the patient level can be measured by how well AC is managing his chronic condition and maintaining his independence. This can be evident in his use of community and outpatient resources such as psychiatric day programs. Also, it is measured by his not being readmitted to the hospital within 15 days under the same diagnosis as before, and not being readmitted to the hospital within 30 days for incomplete management of his diabetes, end-stage renal disease, or hyperkalemia. So basically what I put in the previous slide would be an indicator that it's we're effective as nursing case managers. At the patient level, the involvement of AC's mother is also an indicator that the nursing case management effectiveness is effective, as it seems to influence his drive to manage his chronic illness. So never underestimate how important family is in health management. That's a good tool for case managers. And nursing case management effectiveness at the system level. So as mentioned earlier, mass media campaigns designed to spread awareness of diabetes and promote healthy eating habits and exercise programs was done in New Orleans with it positively impacted its citizens. So this came from that study, and Larson put over the course of the 5-month campaign, researchers observed a significant increase in message recall measures and positive attitudes towards walking and fruit and vegetable consumption. So there's already proof that mass media campaigns has shown system level effectiveness, and so that's something that we can look at further promote healthy habits. And here are my references. Thank you very much.